Okay, welcome back everyone. This is the Policy Lab, and I'm going to talk about my key proposal for universal health care in this country. Alright, quite simply, universal health care just means that everyone receives coverage. It's not as complicated, it's not as costly, and it's a better way to guarantee coverage to all Americans as opposed to the fragmented system we have now. Just a little bit of context. To me, healthcare is a moral issue. We should do something about it because we should have everyone covered in this country. I don't want to compromise on that. I frankly don't want you to compromise on that. I'm going to talk about a Bismarck-style healthcare system in just a moment here. I learned about it, in case you're wondering, by a great book by an author named T.R. Reid. It's called The Healing of America, a global quest for better, cheaper, and fairer healthcare in the U.S. And this book was actually written 15 years ago, right around the time when the Affordable Care Act was first passed into law. And it's funny because even going back through some of these things now, not a lot has changed about the U.S. healthcare system. You see fights about it all the time, especially in Congress, but at the end of the day, it is still a very fragmented system in America. One universal system will always do better. That is what every study has shown. That is what every metric shows. So without further ado, let's dive into it. It's going to be a bit of a longer presentation today because this is such an important topic that I should cover the necessary details so that you understand it and everyone else understands it. As always, if you want to help make universal healthcare a reality, I'm running for Congress in District 2. Your donation goes a long way to help make this campaign a reality. You give me, frankly, a chance to win. If you can volunteer for a campaign, do that. More importantly, as always with YouTube channels, like, rate, and subscribe to this video. Share it with 6 people who want universal coverage, and let's dive into it. Oh, by the way, this is my Woodrow Wilson ducky. They've got universal coverage in the UK. Woodrow Wilson's something of inspiration for me. He believed in universal coverage, and I similarly believe in universal coverage. Anyway, let's dive in. One more really important note about universal coverage is that you will not be able to do it at the state or local level. And a lot of people, they come up to me and say, why didn't you run for local office first? Well, not only is my passion and interest in Washington, not the local level, but if you really want to make a difference in people's lives with regard to healthcare, and universal healthcare is important to me, I know it's important to you at home, you have to go to the federal government. You will not do it at the local level. You can improve access to Medicare and Medicaid at the state level. Many states, of course, have done that over the years. Some of them also, sadly, have taken away coverage, but just to clear the air, if you want universal coverage, you have to go to Washington. Quite frankly, you have to go through Congress. That's not to discourage anything, but that's just to be real about what's needed. How my plan compares to Deborah Ross, current incumbent, because if you go and look on her website, you can see that even with all of her experience, she really only focused on Medicare and Medicaid, which, don't get me wrong, are good programs, at least insofar as they help to cover people's health insurance. But not only are those programs expensive, complicated, they don't cover everyone. So what Deborah Ross is saying, and what she has spent a lot of time doing, was not universal coverage. I repeat, even expanding Medicare is not universal coverage. Universal coverage is essentially making sure that everyone has the ability to get affordable, accessible health care. Medicare focuses on people mostly above the age of 65 and people with disabilities. Medicaid focuses mainly on people who are really disadvantaged. That is the key distinction. Universal coverage of any type covers everyone. Medicaid, Medicare, even if you expand them, does not cover everyone. All right, let's go through the key details of how to make universal healthcare work, or at least talk about my proposal to make universal healthcare work more specifically. It's important to also compare it to the current US system so you understand why we need to do universal coverage. Um, the American health insurance system, it ain't great. It's complicated, it's fragmented, it's expensive, it's not universal. And as you can see through this graphic, from the perspective of private households, so you at home, state and local taxes are used to help fund Medicaid and other programs. Federal taxes help to fund not just Medicaid, but Medicare. And then cuts in your paycheck, if you work for a private employer, help pay for private health insurance, of which there can be several options for private health insurance. And a lot of people, sadly, if they want healthcare from a provider, they have to pay out of pocket at the point of service or use other private spending over time to pay those costs. There's around 28 million Americans, and more likely that number is going to increase given the Trump administration's recent actions. There's a lot of people that just don't have coverage in this country, and that is wrong. We need to fix that. So, that in a nutshell is why we need universal coverage. My proposal differs from others that are out there and how it's implemented, but the goals and metrics are rather, I don't want to say simple, but they're straightforward. Um, we want quality coverage for everyone. We want to expand access to everyone, particularly the people who don't have access to it right now, with no exceptions, none whatsoever. There's always a cost, but we can actually do universal coverage in a way that keeps costs lower, not just for consumer, but lower as a whole to administer the system. And cost negotiation and tight regulations are key to making that work. We also want to give you at home, the individual choice in what doctors you go to. You don't really have many choices with Medicare. You typically have a certified list of providers under Medicare. You can't really deviate from that if you want Medicare to cover things. Building a good relationship with your doctor is important. You should have that ability as well as ability to go choose what doctor you want. And last but certainly not least, as far as metrics go, we definitely want to make healthcare simpler in this country. It is way too complicated. It has been for several decades. You shouldn't need long, crazy packets to know what's covered or not covered, or to understand how it works. One system that covers everyone, as is the case in nearly every other developed country in the world, blows the US out of the water when comparing not just these five metrics, but other metrics as well that judge how healthcare is providing coverage to everyone. It if you do universal coverage, it's cheaper, it's better. It just is that. So, what's my proposal for universal healthcare? It is a Bismarck model, which effectively is a health insurance model that mandates coverage for everyone and that doesn't allow these health insurance companies to make a profit. They're nonprofit. Uh, they're instead though, insurance companies are called sickness funds, and they're usually financed jointly by employers and employees through payroll deductions. Tight regulation gives the government cost controllability. Private doctors and hospitals are still widely utilized. Like I just mentioned, you'll still have the ability to go choose your doctor. And a Bismarck system always rank across the world in countries like France and Japan. Bismarck systems always rank higher than the US on every possible healthcare metric. And more importantly, they always cost less per capita. And in Japan, especially, uh, they even still utilize several private hospitals. It doesn't mean that you won't have public doctors or public hospitals, but you can still incentivize private markets and you can even incentivize innovation even by having universal coverage under a Bismarck model system. Now, the context for terminology is very important here because it's very different from how it works in the US. So, out of pocket in America simply means you are paying for services without coverage, without a healthcare plan. That's very expensive and unaffordable for the individual 99% of the time. Out of pocket, if a country has a Bismarck healthcare system, is very different. Excuse me. That's the amount you pay after health insurance covers a percentage of the cost. You still have fees and copays, and in some instances, such as France, you still have supplemental insurance to help pay for those fees, but you still have coverage and it is overall more affordable for you and for everyone else because coverage is mandated for everyone under a Bismarck style system. And again, it is not always apples to apples when comparing these things, but nothing in life is ever completely free. But the goal is not only to make healthcare costs less per capita under a Bismarck model, but the goal is to make it accessible for everyone while keeping any fees as affordable and low as possible. Price negotiation and regulation are really key to making this work. That is really kind of one of the hallmarks of what a Bismarck style healthcare system is, where there's tight negotiations and regulations about all the services, all the fees, how doctors are paid, all those sort of things get regulated. Now, some people may have some misconceptions both about universal coverage and even about this style of universal coverage that I am proposing. First, this is technically not Medicare for all, and some progressives may be alarmed. However, both proposals would provide universal coverage, and they have many similarities. From what I understand, most of the proposals for Medicare for all out there do make insurance companies nonprofit. They, still do a lot to help keep the cost of prescription drugs low. All of that's still true under my proposal for what it's worth. But another key difference is that my proposal for a Bismarck style system is actually not socialism. Uh, why? Because it uses private markets and doctors still, as I mentioned. And the real difference now is that insurance providers, so sickness funds, are nonprofit. But getting rid of the profit motive is key to making the system work. But it doesn't mean that we can't have, you know, private providers, private markets, and they can still encourage innovation under the system, but they are not out there to price gouge. And again, one streamlined healthcare system is always going to be less complicated for the individual. Uh, and as a result, that will be cheaper overall for everyone. And again, just touching on the point about my proposal versus Medicare for all, there are different systems of universal coverage out there. There's a beverage model, a national health insurance model, and Medicare for all is just one way of doing it, not the only one. The U.S. currently has technically four different types of healthcare coverage without giving universal coverage. And that's why I keep emphasizing the point of making sure that everyone's covered. Um, and again, costs have been on the rise here in the US, especially with Trump's big, beautiful bill now increasing premiums across the country. I'm recording this in October during a shutdown, after all. Now, let's go through some of the other details. So, first, what services are covered under universal healthcare? I put this in bold because it's everything. And it's important to drive home that point. So, the aim again is not only to keep it simple, but very comprehensive. So, you need to go to the doctor, you need to go to the hospital, God forbid, dental visits, specialists, prescription drugs, and vaccines. Your mental health is important. And when you go see a mental health provider, that will be covered. Hearing and vision, covered. Pediatrics, covered. Dietary nutrition visits, physical therapy, covered. The list is long because you shouldn't have to worry about what is covered if you're the individual at home. And if you're here in District 2, I want to make sure that these services are covered for everyone in North Carolina. Again, the government negotiates and lists all services that are covered in a very tightly regulated structure when there is a universal healthcare system in place. What would be the exception, in case you're wondering? Well, typically not much. Treatments that are not regulated by the government, or quite simply are non-essential. One of the examples that I think is a case in a country like France is Botox, that is typically not covered under their universal system. That also being said, under private supplemental insurance, so additional insurance, sometimes those things can be covered. It's just that they are, again, non essential. But the rule of thumb is if it's a life saving service or a healthcare service that is just needed, it is covered. What about prices? How will those work? Well, there are still copays and fees under universal coverage, but again, the key is that prices get negotiated by the federal government. In the case of Japan, they negotiate those fees every year. And also, very importantly, prices are listed up front. In France, when you go to the doctor, from what I understand, typically those prices are basically listed at the door. I think that would be very important here in the US because we've all heard the horror stories of having to, call the insurance company and they weren't really clear about what the price would be after the visit. Um, you should be able to understand what the price is, uh, what the copay would be when you go to the doctor. Doing that right up front at the door is a key to making that a reality. It's a rather simple but very necessary change that is needed. And just to kind of keep talking about price and how this Bismarck style system would work, let's first just take a look at France and a couple of the keys for how this works over there. So in France, you don't lose coverage when you lose your job. You still have coverage. There's no out of network or in network because we're all probably tired of trying to figure out is one provider in network or not. Um, After all, having different networks just limits your options as a consumer here in the US. We need to get rid of that. All right. So there are no out of network or no in network stipulations in France. You can choose your doctors and providers and go pretty much whenever you want. So, again, that relationship with your provider of your choice is very important. And then most importantly, there's also no denying coverage. So, if you're listening to this video, you have a pre existing condition, or maybe you're in one healthcare system versus another, maybe you're on Medicaid, uh, you would still be covered under universal coverage in a Bismarck model. There's no denying coverage under any circumstance. It costs less to administer overall than the US system in France. There's less paperwork, there's less marketing because insurance companies are now non-profit. Hospitals and doctors are typically paid very quickly. There are still some debates about how much doctors and providers get paid. We're not going to talk about that too much here right now, but uh, it is important to note that that discussion is still something that happens. Uh, and just the last few key points about France and how it works over there. The goal of insurance is entirely different because they start with the assumption of healthcare is a right for their citizens. That's part of their law, but also more importantly, they do not design healthcare to squeeze a profit since the providers are all a nonprofit. But you could still use private insurance to help pay a portion of the cover of the cost or your copay. And more importantly, those copays are cheaper because the mandatory insurance covers anywhere between 70% to 100% of the cost of your visit. And this picture to the right, it is the carte vitale. I think I said that right. I probably didn't. But anyway, it is basically a little green card that is used not just for healthcare, but other social security benefits in France. And it does a lot to make administering the healthcare system there much more streamlined. When you give this card to your doctor's office, it effectively shows them all your medical history, your records, all the information that a provider would need to know. So, as many of you are aware, in the US, if you go to a new provider for the first time, you've got to fill out all these forms. You've got to make sure that your medical history in some cases gets shipped over. So that process not only takes time, it often costs a lot of money. The French make it cheaper and easier by having this card. Um, it's sort of a symbol for healthcare over there. So I want to make sure I touched on that. Okay, let's also talk about Japan because not only are they one of the uh, best rated healthcare systems in the world with the Bismarck model. But this graphic does a really good job of summarizing how a typical patient would deal with copays in Japan under a Bismarck model. So, primary care visits, specialists, hospitalizations, prescription drugs. Typically, the fee is that the healthcare system covers about 70% of it. There's a 30% co-insurance. There's a maximum out of pocket. Typically, it's done with a monthly cap. It varies by age and income. So, for example, if you're low income in Japan, your out of pocket monthly would be around 354 US dollars. Um, Moderate income people, under the age of 70, it's a little bit higher. So it'd be no more than 800 US dollars. There's also annual caps, but more importantly, there's also safety nets in place to still make sure that healthcare is affordable and everyone gets covered. So there are reduced co-insurance rates for people with chronic illness, children aged 6 and younger, older adults with low income, and there are more safety nets for people with uh, disabilities, mental illnesses, and other chronic conditions. So again, in short, the goal is to not only make sure that everyone is covered, but make sure that if there are any copays or fees, that they are not only both reasonable but affordable for everyone, so you don't incur significant debt. Administration is still important, but it's effectively one agency when you do universal coverage. Um, doesn't mean other agencies couldn't be a part of it, but in my proposal, I want the Bismarck system to be administered by the same agency that actually administers Medicare and Medicaid now, the Center for Medicare, Medicaid Services, CMS. If you look at countries like France and Japan and others, they typically follow that same structure. You have one or two agencies that at the federal level that administer and provide oversight for the system. And again, the key point to note here is that under a Bismarck model, CMS would not be paying for the coverage, as is the case with Medicare, but instead, the CMS only regulates the system, helps determine and negotiate prices and a list of services, and most importantly, it provides oversight and accountability for the sickness funds to make sure that they are doing everything um, legally and above the board. So, why do I like the Bismarck model? Well, again, it's the same goal as Medicare for all, universal coverage. We're effectively on the same team there if you're a progressive listening to this, but it's also got tighter regulations. It's a simpler model for people to follow, generally speaking. Nonprofit insurance companies are a must. We have to get the profit motive out of healthcare coverage because that is why one of the main reasons why healthcare costs have been really hard to keep down over the years in this country. And again, everyone is covered, but private markets still play a role. Doctors are still private, they get compensated fairly. And it's a system, frankly, that's going to feel very familiar to most Americans because if you have private insurance right now, again, I'm recording this in October 2025, then you effectively are already doing most of this. It's just that insurance companies in the US currently are for profit, but the for you as the individual, it would not look that different. If you have private insurance in the US, you already have a portion of your paycheck that goes to paying that private insurance. That is exactly how the Bismarck model is based off of. The difference is now that coverage is mandatory, and it's also mandatory that every employer gets into the risk pool and actually, has their payroll taxes and deductions go to this Bismarck system so that everyone can receive coverage. Now, let's talk a bit more about what this could look like in practice. So, say tomorrow Congress finally passes a bill, shocker, that allows for universal coverage through a Bismarck model. We'll go through a fictional example of a guy named Tom Blue. He's a 27-year-old self-described finance bro who works in downtown Raleigh Monday through Friday. His annual salary is 55,000 a year. He does some healthy activities, but still drinks on occasion. He sometimes goes out to Glenwood on a Saturday night. He's not perfect, but Tom also made some mistakes when he was younger that still linger today with health conditions. He got into a fight at a bar when he was 21 years old. It was not a smart decision, but his shoulder hurts because of what he did. Tom also had a pre-existing condition when he was 5 years old. Maybe he, excuse me, maybe it was asthma, or maybe it was some sort of heart condition. You know, maybe Tom's been struggling with that. But Tom's payroll taxes now allow him to choose a sickness fund that provides him health care coverage. He is not denied coverage, regardless of what pre existing conditions he had or what he did in his past. Tom Blue receives coverage under a Bismarck style system. 5 years later, so Tom's in his early 30s, he hits some adversity in life. He got married. He now has a 2-year-old daughter, but he lost his job in finance due to a recent layoff. Well, that's certainly challenging from a career point of view. But Tom can keep his current sickness fund because everyone who is employed, excuse me, pays into the Bismarck style system through payroll deductions. That risk pool is much bigger to make sure that everyone can be covered. Even though Tom may have changed, excuse me, his ability to receive healthcare coverage did not. He doesn't have to worry about paying for an extra premium. I repeat, even though he lost his job, he does not have to worry about paying an extra premium. More importantly, his young daughter also is covered under a sickness fund, just as many insurance companies already allow in the US. So, again, I illustrate this example of Tom Blue because it is a story that is very familiar to most Americans, not just in terms of how the current private insurance model works and how it would look very familiar under the Bismarck model, but just to show the point that, you know, a lot of things can happen in the course of your life, and whatever it is, we want to make sure that you are covered. Very similarly, with other groups that are covered or should be covered at least under the US healthcare system: veterans, old people, adolescents, retirees, all covered. The current system makes it so that these groups have to basically go somewhere else to get coverage. They have to go to Medicare, they have to go to the VA, they have to go through a different system than someone like Tom Blue, who's maybe in his 30s, 40s, whatever it is. Instead, we want to make it all one system that covers everyone. Now, the caveat, if the universal system were passed at the federal level, would be that you're likely going to need a transition period to make sure that there are no gaps in coverage for these aforementioned groups, because we basically want to roll over veterans, any retirees, things like that, into a Bismarck style system. So making sure that the right steps, outreach, education, and you know actions are taken to make sure there are no coverage gaps when you do universal coverage is really important. That also being said, there are some challenges to this. Excuse me. Nothing's ever perfect or apples to apples. New technology plays a big role in healthcare. It'll continue to, obviously. Here in the Triangle, there's obviously three major research universities. They have played a major role in new treatments, uh, new services, and new technology. We want that to continue to be the case. Public health and mental health play a pivotal role in healthcare in this country and helping to keep costs low. I will probably do a separate video here soon on public health, but access to impoverished or low income areas is always hard, and that's a major challenge. But the key to making universal coverage work is to ensure that there's a serious effort by the government to reach out to those folks and make sure they not only get coverage, but understand how it works. Because we want to make sure that everyone has the healthcare providers and services that they need to stay healthy. Nothing is ever free overall, but universal coverage is basically designed to make sure that not only is everyone covered, but no one incurs any serious medical debt. I think I can speak for just about everyone in saying that we are tired of seeing the stories of someone going through something unfortunate and having to go on something like GoFundMe to help pay for the medical bills. If we have universal coverage through a Bismarck style system, we can stop that. We don't want people to go into serious medical debt. Everyone will always fight over how to do this. All right. Even in countries like France, Japan, where they're always rated much higher in terms of healthcare outcomes, there are still debates going on in those countries about how to best do universal coverage, but especially from the perspective of providers and insurance companies over there. But universal coverage is worth fighting for. And I want that to really be the lasting impact here is that we need universal coverage because it is the right thing to do. It is what you deserve to have. I deserve to have. The guy down the street deserves to have. Even the person you may not like. We all should have access to healthcare coverage. That is something I will stand up for. That is something that I know this country can do. We just got to start taking the steps towards universal coverage. Lastly, real quickly, if you want just more context as to not only where I got these ideas, but if you want to just learn more about universal coverage, the Commonwealth Fund is a nonprofit that does a lot of really good research on healthcare around the globe. You can see their page, excuse me, you can see their pages that do a really good job of summarizing how it works from one country to another. They, of course, do the same for the US, so it makes it much easier to compare things. Comparative policy is not only something I've done for a long time, but it is a really effective tool to understanding um, the ins and outs of how public policy works. And another book that really inspired me was The Healing of America by T.R. Reid. It was written right around the time when Obamacare was passed in 2009. But what's interesting is not much has really changed since then, both in the US and oftentimes in many of these different countries. There are obviously changes in some of the smaller details about how healthcare is administered in other countries, but the goals typically remain the same in a place like France or Japan. Um, so again, Healing of America by T.R. Reid is a good book. The next episodes of the Policy Lab will have connections to healthcare. We want to talk about universal income, which is key to paying for food, energy, and healthcare expenses, among other things. And like I mentioned, I do want to do an episode about public health and mental health, as that is key to helping ensure that healthcare costs are low. Lastly, just to really end this video, I want to say that if you want to help make universal healthcare a reality, please consider donating to my campaign. I'm running for Congress in District 2 to help make universal coverage a reality. If we want to make it not just something on paper, but something that you can benefit from, I need your help. Um, whether it's donation, whether it's your vote on March 3rd, or whether it's even just liking, sharing, and subscribing to my YouTube channel. All those things go a long way to help take those steps to make universal coverage a reality. Thank you so much for watching this video, and I will see you in the next one.